Happy birthday, baby!
Welcome to the Origins family.
Mom and anyone who's taking care of mommy or baby in the next 6 weeks
needs to listen very closely to these important postpartum instructions to help ensure the health and safety of both mama and your newborn baby. Okay, mommy, now that your sweet baby is here, let's talk about what's normal and not normal for you and your baby. I'm gonna start with you. You can expect heavier than a normal period, than the heaviest day of your period, bleeding in the first 24 to 48 hours. If you're filling an overnight size pad, so one of these big ones, front to back, side to side, in 30 minutes or less, that is abnormal and you should give us a call. You can expect clots, but we prefer them to be smaller than the size of a large egg. If you experience anything larger than that, let's use our technology, take a picture, text the on-call number, and we'll give you a phone number that you can send your picture text to. To prevent heavy bleeding, some of the most important things that you can do are to keep your bladder empty. So sometimes you lose a little bit of feeling in that area, so it's important to get up from your bed and go potty about every 2 hours. Some other things that you can do if you feel like your bleeding is a little bit too heavy is just find your uterus, find the very top of it, just like we've done in the postpartum period, push down on your tummy, massage the area, and your bleeding should slow down. If it does not, after doing that, please give us a call and we'll give you other tips to help you along the way. As far as keeping everything nice and clean, we're happy if you want to take baths, but please just make sure that the tub has been cleaned thoroughly prior to, with some Clorox wipes, none of the wonderful natural stuff that we like to use, but please use the heavy duty bleach or Clorox wipes. Wipe it down, fill it with cool water, rinse that out, and then you may enter the tub after that. Make sure that if you've had stitches that you keep any Epsom salts out of your bath, and make sure that your showers are kept to 15 minutes or less, using warm water, not hot, especially in the immediate postpartum period. Let's talk about perineal care, mama. You have just pushed a baby outside of a very sensitive area of your body, so we want to help you know how to best take care of that. We're going to send you home from the birth center with what's called a peri bottle. At each and every time that you need to urinate, you're going to fill the bottle with warm water only. You're going to use the bottle to help you gently wash away any of the bleeding and any of the urination that's happened that causes a little bit of stinging in the first few days. This peri bottle is your new best friend.
Nothing up inside the vagina, no tampons, no douching, and no husbands, sorry guys.
We recommend that you wait to have intercourse until your 6-week postpartum appointment. Your midwives will check to make sure that everything is healed properly and let you know when it's safe to move forward with that.
We expect you to be on strict bed rest for a minimum of 3 days. If you've had sutures, then sometimes we ask for 5 days. We'll give you those instructions personally and one-on-one. But a minimum of 3 days should be spent in your bed, snuggling your newborn baby. So we want you to eat in bed, drink all your water in bed, nurse your baby in bed, do all those wonderful things from the comfort of your own bed. The only reason that you would be getting out of your bed is to go potty, take a bath, or a 10-minute shower. Remember that we want you on the strict bed rest for 3 to 5 days, but then we want you on moderate rest for up to 2 weeks. And so what that means, mommy, is that you are not doing any dishes, you're not doing laundry, you're not picking up toys, you're not vacuuming the house. This is your only 2-week vacation and we want you to enjoy it. Not only is it best for you and your sweet baby, but it will be what's best for your family in the long run. Our mamas that listen to us and take their full 2 weeks off, they recover so much faster that they're able to get back to 100% much more quickly than our sweet mamas that feel the need to get back to doing all of their regular activity as quickly as possible. Also, please remember that you're not going to lift anything heavier than your sweet baby for the first 4 weeks. So your sweet little toddlers that may be running around, we welcome them to be snuggling with you, but snuggling just looks a little bit different. You're not bending down to pick them up. You're letting them crawl into bed to snuggle with you on the couch, reading them stories, doing all the wonderful things that you normally do as a mama, but you're just unable to bend down and lift them. So that way your uterus can return back to its normal placement, and all of the vital organs that have been displaced during pregnancy are able to return back to their normal locations. As far as nutrition goes, we want you to eat an additional 500 calories over your regular pregnancy diet. Please be sure that the additional calories that you're adding are healthy, good, nutritious calories. We don't want you filling your body with junk food, because then you're gonna feel like junk. And we want you to feel healthy, well rested, and able to complete your day's tasks ahead, which is a lot whenever you have a newborn baby. So let's fill our diet with healthy, nutritious fats like avocados, coconut oils, ghee, butter, any of those wonderful healthy fats that you can to add into that 500 extra calories, so that way your breast milk comes in nice and plentiful and also with plenty of calories to feed your sweet baby. We want you breastfeeding your precious newborn every 2 to 3 hours, and that is from the start of one breastfeeding session to the start of the next. So what that means is if your baby nurses for 30 minutes, that in as little as 1 hour and 30 minutes to a maximum of 2 hours and 30 minutes later, you would be starting your next breastfeeding session again. Please remember that newborn babies are very sleepy in these early days. So it's important that you as the mama wake them up so that they can get a good nursing session in. Sometimes that can be proved to be very, very difficult. So some of the tricks that you might want to utilize is undressing your baby, starting with that. See if that wakes them up enough to get in a good nursing session. If that doesn't work, please get a cool, wet washcloth and try sponge bathing your baby on the trunk area, on the palms of their hands, the sides of their sweet little face, and they may wake up enough to give you a good nursing session. If that doesn't work, there's some other mean tricks that we can teach you along the way. When it's time to breastfeed your baby, even if they're screaming their poor little heads off, the most important thing that you can do is to first go into your bladder. Again, that's going to help with your bleeding. It's also going to help mommies with your afterbirth pains. So please make sure that every breastfeeding session you start off with an empty bladder and a full glass of water, because while you're nursing your baby, it's important that you drink at least 8 to 12 ounces of water each and every time, and that will give you the adequate hydration that you need in order to bring in a full milk supply. As far as your nipple care, your nipples have probably, if you're a first-time mom, not ever been exposed to this much stimulation at the breast. And even if you're a second, third, fourth, or more time mom, your breasts have not been used to breastfeeding a brand new baby. So please make sure that after every breastfeeding session, you apply a thin layer of either calendula oil or lanolin to prevent as much nipple soreness as possible. Cracked or bleeding nipples are not normal, and we would like to know if you're experiencing these problems. As far as exercise goes, sweet mama, you are not allowed to do any type of vigorous exercise until you are cleared for that at your 6-week postpartum visit. Your midwives will be happy to check you out and make sure that you're ready for the activity level that you need. We know that you're anxious to get back to exercising, sweet mama, but we want you to do it in the timing that is safest for you. So there's not any vigorous exercises until your midwives have cleared you at 6 weeks postpartum. We'll be sure to let you know when you're ready to get back to it. Until then, you may walk around the neighborhood, and by doing that, I mean a block or two, only at 4 weeks and only if your bleeding is very slight. As far as your emotions, Mama, you have had 9 months of extra hormonal support. And so when you release your placenta, that can trigger in your body a loss of hormones that your body has grown accustomed to over the last 9 months. When that happens, you can get a little slight case of baby blues. It's completely normal as long as that's dissipated by about 2 weeks postpartum. If you're experiencing anything more severe than just sadness here or there, weepiness at sweet little things, then your midwives want to know about that. Some of these signs and symptoms can include anxiety, rage, obsessive compulsive thoughts about your baby or the house or yourself. And those things would be considered abnormal, and we would like you or your partner to give us a call as quickly as possible. All right, now let's switch over and talk about your precious newborn baby. So one of the most important things that we look for to make sure that your baby is healthy is an adequate amount of output. We always say in the breastfeeding world that input equals output. So what we're looking for is in the first day of life, we would like 1 wet diaper and 1 poopy diaper. On the second day of life, we would like 2 wet diapers and 2 dirty diapers as well. On the third day of life, 3 and 3, and that continues until you get to about 5 to 6 dirty diapers a day and 7 to 8 wet diapers a day. Anything over that is just bonus and nothing to be concerned about. If your baby is not having adequate output, we would like to be informed. It can be normal for a newborn to go a day, maybe 2, without a dirty diaper. And so if that's happening, we would like to be informed of that, but there's no worries as long as it's just a day or 2. Okay, mamas, these new diapers have this yellow stripe down the bottom. They usually turn blue once the diaper has been wet. So that's one way to determine if your baby has a wet diaper. However, these brand new diapers that they're making these days are so absorbent here that sometimes it's difficult to tell if your baby has had a wet diaper. So one of the things that you can do is use a piece of toilet paper or a Kleenex, fold it inside the diaper like so, and then you'll be able to see if that small amount of urine in the first couple of days has produced a wet diaper. And that counts as your 1 wet diaper or 2 wet diapers for the day.
Using olive oil helps to wipe the meconium off. Since the meconium is so sticky, it is advisable that you just go ahead and saturate baby's bottom with the olive oil so that the next diaper change at 2 o'clock in the morning is going to be a little easier.
Your baby has probably had an herbal bath here at our birthing center. That will be the last time that your baby is submerged in water until the baby's umbilical cord stump has fallen off. So we want to help aid in the process of it falling off so you're able to take baths with your baby, bathe your baby as you would like, and so on and so forth. Once you're at home with every diaper change, we recommend that daddy, because remember mama, you're still on strict bed rest, that daddy blow dries the umbilical cord for about a minute at each and every diaper change. You're going to put it on the warm setting, hold it about 6 inches away from the baby's cord stump, move the cord stump around, don't be afraid of it, and get it nice and dry along all of the areas. This will aid in the process of letting the umbilical cord stump fall off so you can go about bathing your baby as you normally would. Your midwives will be happy to remove the cord clamp at your first postpartum visit. Also, please keep in mind that an infected cord smells horrible. So you're looking for red streaks around the umbilical cord stump, a foul, putrid odor. If you notice any of these things, please just give us a call so that we can help your baby as quickly as possible. Yellowing of the skin is normal after the first 24 hours. This is because of high bilirubin levels. One of the things that we want to have happen is to go ahead and flush out the bilirubin as quickly as possible. You will be able to achieve that with frequent nursing and indirect sunlight. We would like you to place your baby as often as possible next to a window that's open, and so that way they can receive the vitamin D that helps them to flush out the bilirubin levels, causing their skin to look a little bit on the yellow side. If you notice yellowing of their skin within the first 24 hours, that is abnormal, and we would appreciate a phone call about that. The way that your baby left the birth center is the best way to tell if your baby is healthy. A nice, pink, vigorous baby, even ones that are sleepy but remain pink and healthy, that is a normal baby. Signs that your baby are struggling are pretty obvious. One of the things that are most important that we look at is respiratory distress. That is the most common sign or symptom of an unhealthy baby. If you're worried about your newborn's respirations, we ask that you would count them for a full 1 minute and then let us know how they're doing. Respiration is counted by an inhalation and an exhalation of the breath. That is 1 respiration. Normal respiration counts for a newborn baby are between 40 and 60 breaths per minute. If it exceeds it by a couple of breaths or under by a couple of breaths, that's nothing to be concerned about. But if your baby is breathing rapidly, looks like he or she is struggling, like as if they had run around the block with deep retractions here in the ribs, blue around their nose and mouth, blue here in the trunk area, that is all considered abnormal, and we would recommend that you do a respiration count for a full 1 minute. Give us a call and let us know about it. Also, if your baby is grunting, it sounds like this. Please note that it's on the exhalation of the breath. It goes, That is abnormal, and remember that it can also be high-pitched, and that sounds like this. All of that are not sounds that we like coming from a newborn baby. However, please also remember that babies make the cutest little sounds, and those sounds are nothing to be concerned about. It would only be cause for concern if it's happening with each and every breath. That is a sign of labored breathing. Please remember, mamas, that you are not looking for retractions in the xiphoid process area, which is the triangular space underneath the breastbone, like doctors teach us to look for in our toddlers or older children. That's signs and symptoms of respiratory distress for them. However, newborn babies are belly breathers, and you're gonna notice that little triangular spot coming in and out regularly. That's normal. We're looking for retractions here in the rib area and then flared nostrils with each and every breath. Those are considered abnormal for a baby. If your baby stops breathing for longer than 15 seconds, please call 911 first, and then please call your midwife. Also, please keep an eye on your newborn baby's temperature. We expect that every so often, at least during the daytimes whenever you're nursing, that you would just check in with you and your baby as far as your temperature. We want babies to be less than 100 degrees all of the time. It's not like with a toddler running around. Some of you more experienced mamas would know that we just kind of let things run their course. With a newborn baby, that's not what we do. A temperature is considered a medical emergency. So you would want to, if you felt like your baby was too warm, go ahead and take their temperature. If it's above 100 degrees, you're going to remove their layers of clothing, leave them down to just a diaper, away from your skin for at least 5 to 10 minutes, and then retake their temperature. If your newborn is running a temperature over 100 degrees, please call and do not text the on-call number. This is considered a medical emergency, and we want to make sure that you and your baby know the next steps to do in order to take care of your baby.
Skin-to-skin contact is vitally important for mom and baby. Skin-to-skin will help bring your milk in more quickly. It will help regulate your baby's respirations. It will help regulate their heart rate, their glucose levels, and even their body temperature. The more you can do skin-to-skin with your newborn, the better. It also helps stimulate love hormones like oxytocin that will help your recovery as well. You cannot spoil a baby. The more you hold them, the happier you'll be and the happier they will be.
This is actually my favorite thing to talk about, and this is your baby's emotional well-being. The old adage that you can spoil a baby is just in fact not true. Your little baby is already spoiled. He or she has lived in a dark, warm, wet environment for 9+ months. And so they are exposed once they're born to bright lights, loud sounds, sensations to their skin that they've never experienced before, and it can be overstimulating for a newborn baby. So please, please, please be sure that you are loving on your baby as he or she needs. If they're crying, that means that your baby needs you. So please take care of your baby and don't worry about spoiling them. They are already spoiled and you can't spoil them anymore. It's important that you spend as much time as possible skin to skin with your baby. We know that you're gonna have probably lots of visitors here in the first couple of weeks because everybody wants to see the newest addition to your family. So it's hard to get in those hours of skin to skin that are important. So I'm gonna start with the reasons that are beneficial for you and your baby to do skin to skin. The first and foremost and most important thing for skin to skin is that it regulates not only your baby's vital signs, but it also regulates your sweet mama. So your brains are literally connected and they're talking to each other each time that you place your baby skin to skin with you. This helps to regulate your baby's breathing patterns, their heart rate, their temperature, and all of the things that help keep your baby normal and healthy. It also helps to regulate your heart rate, your blood pressure, your vitals, mama, and also helps to bring in a more plentiful milk supply for your baby. So please keep in mind that it's important to spend as many hours per day in that skin-to-skin position as possible in the first few weeks of life. Some of the best ways to achieve that is to get one of those nice robes, keep yourself undressed underneath, put your baby in just a diaper underneath that, cover you both up, and that way your guests and visitors know that it is not time for them to hold the baby, but in fact, it's time for you to hold your baby and be doing skin to skin while visiting at the same time. If you feel the need for yourself or your baby to go to a physician or hospital for any reason within the first 6 weeks of life, please call us first. We've been known to save quite a few $1,000s of medical bills or be the ones to tell you that a small problem that you may think is small is in fact a good reason to go ahead and take your baby or yourself into the hospital.
And remember, Origins Mommy,
Your Origins midwives are available to you 24 hours a day, 7 days a week through the on-call number for your emergent needs.
And please remember to utilize your maternity neighborhood account for any of your non-emergent needs. We want to help make your postpartum period as smooth and easy as possible.